Hello, welcome back to my channel, Victorious Human, with me, Violet. Today we're going to be touching on a new topic, completely different. This topic caught my attention because it read new definition of nursing. I was like, hang on, what is that? What is that all about? As you might already know, nursing is founded on 8 principles. So 8 principles of nursing. They go from principle A all the way to H, and these include equality, diversity, inclusion, accountability, safety, clinical, self-care, personalized, person-centered care, communication, knowledge and skills, personal standards, and leadership. So I think the new definition will try to encompass everything. And as you already know, nursing has become complex. Things have changed. So as nurses, we're going to be seeing different patients. And at present, we're already looking after different patients. From category A all the way to Z, we are seeing it all. Which is why the definition has changed. So, as you might have already noticed, nursing is changing, and today's nurse not only cares for patients, but they also care for relatives and the patient's social needs. And they must be computer literate, otherwise it's a no can do. It is only logical that Royal College of Nursing, or RCN, updates the definition of nursing. This was done in recognition of how complex nursing has become. The average nursing duties or responsibilities are ever increasing. So, the new definition of nursing states that nursing is founded on 4 pillars, which are clinical practice, education, research, and leadership. This is because every nurse is expected to use evidence-based knowledge. All that means is that you use the latest guidelines from NICE, NICE, when you are treating, assessing, or in contact with your patient. You use the latest guidelines. You need to be professional in the way that you talk, in the way that you dress, in the way that you conduct yourself. And in whatever problem area you identify for yourself, just work on that one. Don't bash yourself, work on it and improve, get better. Anyway, as you know, nursing is an ongoing profession, ever learning. You're ever learning. You never stop. There is no time you say, I've learned all I can learn about nursing, so now I can stop. No, you're always learning, you're always studying, because it's ongoing. So one must be professional and use clinical judgment to assess, plan, implement, and evaluate all patients. And did you know that as a nurse, you also get to educate your patients, especially those with long-term illnesses or with chronic illnesses? You need to educate them so that they're not always coming to the clinic or not always coming into hospital. You educate them so that they can do small tasks that doesn't need a nurse, that they can do at home themselves. So you assess them, you see that they are capable, they understand what's being asked of them, and you educate them, and they can do, like taking blood pressure, they can do that themselves at home. And they will only contact you at your appointed time. They will no longer need to be coming to have their blood pressure checked by you. No, they can do that at home. And also, one other thing about nursing, one of its biggest value is person-centered care. You are basically acknowledging, as a nurse, you must acknowledge that each individual is different and they must be treated as such. An individual. So you treat each and everyone as an individual. Why? Because everyone experiences the disease process. For everyone, it's different. It is different. They go through it differently. What works for Mr. Jones might not work for Mrs. Jones. So treat each person as an individual. Yes, there is a framework, like care plans, they are there. That's why you individualize the care plans, the risk assessments, so that you are tailor-made for each patient, so that it is what? Person-centered. As you might already know, you now get to look after a range of patients from range of diseases from A to Z, which is why nursing has become more specialized and more complex. So every nurse is expected to what? To remain vigilant in order to promote patient safety and to prevent avoidable harm. This is where risk management comes into play, whether in the hospital, clinic, GP surgery, hospice, or private setting. You will have to remain vigilant. So what makes a good nurse? Apart from being a clever clogs, micro OCD, investigative, a good listener, good communication skills, a computer whiz, patience. Apart from all that, what does make a good nurse? What does it take to be a good nurse? This, I think, is a major ka-ching. You need to be compassionate. If you lack compassion, I'm sorry to say, you cannot be a nurse. Simply don't do it, because people can be trying. They can try your patience. They can really be trying situations and everything. So if you're not compassionate, don't go for it. Nursing is not for you. I can tell you right now, nursing is not for you if you are not compassionate. Which leads to compassionate leadership. So this is now, as a nurse, you're a leader anyway. You are an educator. One moment. So you must be compassionate in the way you are leading and guiding people. Compassionate leadership. So what does compassionate leadership mean? It means that you focus on relationship through careful listening. So when you are listening to people talk, you are listening actively. You are listening to understand and not to judge. You empathize and you support others. You make people feel valued, respected, and cared for. So why do you do this? Because you want them to reach their full potential. If you're leading a team, you want them to reach their full potential. You don't want to be the only one who's number one. You want everybody to be operating at the highest level, which is why you encourage people to go for training, attend training, supervision, clinical supervision, and what have you. Why? Because at the end of the day, every nurse must aim to develop their decision-making skills, their clinical judgment, their problem-solving skills, their leadership skills, their delegation skills, their management skills. They must be, did I mention leadership skills? They must be innovative and they must be flexible. It's not easy, but it's something you can aspire to. Why? Because you are handling humans who are at that moment vulnerable. They are feeling lost, they are frightened, and at times they are at death's door. So, this has been a watered down version of the one RCN published. If you want the formal document, I would suggest you visit RCN website, or you can also visit NMC website, and you can learn and read for yourself. I think that is enough from me. I have said more than enough. Goodbye. Have a blessed day. Bye.